چیکار کنم؟ لایو این سب کنیم کامنت رو ببرنش دکتر صاحبی کو I should turn off the comments. Assalamu alaikum.
Assalamu alaikum.
How are you doing?
I'm fine, thank you. And yourself?
Alhamdulillah, I'm all right.
Alhamdulillah.
من یک کمی اینا که باید باید تکنون تصویرم توش باشم کامنتم من اینجا من آف کامنت مالی سریع Okay, with your permission, we can start now.
Yes, I am with you.
بسم الله الرحمن الرحيم وبه نستعين إنه خير ناصر ومعين اللهم كل وليك الحجة بن الحسن صلواتك عليه وعلى آبائه في هذه الساعة وفي كل ساعة وليا وحافظا وقائدا وناصرا ودليلا معينا حتى تسكنه أرضك طوعا وتمتعه فيها طويلا. With salutation to Imam Mahdi alayhi salatu wassalam, I would like to present my and our salutation to all of our great audience. I'm pleased and I'm privileged today to have my dear brother and my guest, Dr. Murtaza Safavi, who is a full professor of nutrition. And we are going to have some discussion about fasting, accelerator or preventive. And in this regard, we are going to talk about different issues. But before doing that, I'd rather to introduce again to all those people who are newcomer to our program and to our live program that what is IRIC? In this regard,
in 1990, a group of Muslim graduate students in Washington, D.C., USA, established the Islamic Research and Information Center, IRIC, as a nonprofit NGO. IRIC attracted highly qualified and talented researchers and experts to undertake projects related to contemporary Islamic issues in the Western world. Our vision is introducing Islamic teachings to the public in the West, with particular emphasis on research and academia based on the Holy Quran and the traditions of the Holy Prophet of Islam, peace be upon him, and his infallible progeny.
Okay, I hope we do have now a better vision that what does IRIC do and how long has it been established. My name is Dr. Mohammed Hussein Qarabi or Gharavi in the United States, and I'm a physician. My specialty is in pain management. I am currently in a private practice, and I'm also privileged to have some kind of knowledge about Islamic issues, and I have the privilege to be in Oasis Educational Foundation, a member of this great foundation, which is established in Washington, D.C. many years ago. And I would like to ask Dr. Safavi to introduce himself as well, please. Go ahead.
Yes, Bismillah ar-Rahman ar-Rahim. As Dr. Qarabi, my dear friend, introduced, my name is Dr. Sayyid Murtaza Safavi. I am a full professor of nutrition and teaching at University of Isfahan Medical Science University. And it's my privilege to have this discussion tonight from Iran and today from you in the United States and maybe some other places in other places abroad. This is a very important issue that we could understand exactly how nutrition can have a role in fasting, and apart from the effects of spiritual matters. Also, the health aspects of fasting is very important. So we want to discuss this issue tonight with you.
Dr. Safavi, there are some questions some people have in mind, some people have informed us, and some dear colleagues in IRIC have informed me about these questions. The first question normally is asked is about coronavirus, which is unfortunately COVID-19, so abundant in all around the world, and it has become a pandemic. And unfortunately, this situation has caused the economy of the whole world, based upon official statistics, to retrograde, go back and become about 40 years behind as what we used to be. So the first question for Muslim community is, what is your opinion, number one, about fasting during the month of Ramadan in the coronavirus condition? And what do you suggest and what do you recommend as a professor in this area who has a lot of experience, which I'm proud to have you today in our program? What should we take and what should we eat, or what should we use, as a matter of fact, for our daily basis during month of Ramadan, considering the pandemic?
Yes, very good question, actually. The main thing is about our immune system. And this disease and this virus can easily involve people when their immune system is low. So the best thing to offer to people, especially in this month of holy month of Ramadan, is to suggest to boost the immune system with the foods that are very good for that. For instance, when we talk about immune system, we talk about antioxidants. Antioxidants such as vitamin C, and also in fat-soluble vitamins, vitamin D, vitamin E, and vitamin A, and also provitamin A, which is all of the carotenoids, for instance, that can change to vitamin A in the body. And in fact, they can prevent these sort of disease, these attackers that they come to our body, if we have enough vitamins that are antioxidants, and also the minerals such as zinc, selenium, magnesium, that they have these sort of effects, antioxidant effects. They can help us to do not involve in this virus and the following problems and difficulties that will occur later on. So if we want to go ahead some more about the foods that are good in those vitamins and minerals, we should first of all explain about vitamin C, which is in citrus fruits such as orange, lemon, sour lemon, and also sweet lemon, and also in tangerine and other things like grapefruit, etc. Also, we want to mention some points about vitamin D, which is very important. Unfortunately, most of the countries, they have low vitamin D, and this vitamin D is we can find them in fish and fish products, and also in other sources such as yogurt, and also in milks that they are fortified with vitamin D. So we should offer all of the community to get more vitamin D from these sources. And also vitamin E is one of the very important, one of the main scientist in this section of vitamin E has explained that the vitamin E is the most effective antioxidant vitamin in the world. And he's Mr. Burton from United Kingdom that he explained about the vitamin E and effect of that. You know that vitamin E comes from everything. So they thought that since vitamin E have lots of effect, they call it E because of the word everything. So antioxidant effect is one of the main roles of vitamin E. As I said, so vitamin E, vitamin D, and vitamin C, and also vitamin A is very important, and provitamin or some vegetable sources such as carrot, which is this carotenoid comes from carrot, and carrot and also other orange and yellow vegetables and fruits like melon and also watermelon. They are very good sources of carotenoids that they are provitamin A, and they are very good for immune system. So also about zinc and also other minerals that are such as selenium that are on antioxidant. I should explain that these minerals also very important to get to avoid coronavirus. So in holy month of Ramadan, we offer our Muslim brothers and sisters to take these sort of vitamins and minerals much better than before to avoid this coronavirus and also help themselves to boost their immune system.
Thank you so much. I appreciate what you said and for vitamins and what we need for antioxidants. So let me add some more thing from direct practice of medicine during month of Ramadan. Emphasizing for what Dr. Safavi stated so far, I would like to mention a couple of things for you which is important. First of all, keep in mind, we never ever have one single prescription for the entire population of the world. Meaning, there is no way to have one single prescription to give to each individual. So, the question which was presented was originally, what is the condition during the pandemic condition, and is it better to fast or is it better not to fast? Okay, as stated, we do have during the month of Ramadan for fasting, we do have two different approaches. One is spiritual and the orders of the beautiful religion of Islam. Secondly is our physical and maintenance and possibilities of how do we work. So I'm going to postpone the spiritual aspect of fasting during the month of Ramadan a little bit later, possibly to the last part of our discussion, but continuing for what good information Dr. Safavi presented, I would like to mention a couple of few points. Number one, keep in mind that when you fast, of course, sugar or glucose we call is going to reduce in your body. By reduction of glucose in your blood, automatically based upon what beautiful Almighty has created, Almighty beautifully has created important point that when your blood sugar decreases, automatically the pancreas gland, which is responsible for secretion of insulin, also it becomes less active. By reduction of your insulin in your body, automatically your immune system increases and goes up. And this is a very, very important factor, that if you fast appropriately as ordered by Islam, not something made by human being. If you do it that way, automatically you increase your immune system. So you will be more and more immune against any kind of bacteria and virus. Like it or hate it, doesn't matter. Let me make an example. What did I say for mankind? Man-made versus created by Almighty. God has created the nature. Let's say just imaginary. Let's say you sit in a boat in a river or the sea. Drop a couple of points, which I'm going to say, a broad leaf of a tree into the sea or the river, or a very thin layer of a wood and drop it. Do you know what happens? These two, because they are created naturally, they degrade, and gradually they become less and less in their quantity. Fish and other sea products and sea animals are going to take these and they're going to eat it and compensate the cellulose in their body which they needed. Instead of these two, imaginary, please never do that. But imagine that if you do, take some nuts, some cashews, some almonds, some different things, and drop your plastic bag into the sea or the river. Do you know how many fish and turtles are going to die because of that? Similarly, as we have a narration from Imam Muhammad Baqir, salawatullah alayhi, the fifth Imam, Allah has created many things, but before presence or creation of any virus or bacteria, the remedy and treatment for that is available. He has created the remedies, the treatments, possibilities of getting well before that disease was there because of some improvement for our physical possibilities and longer life and longevity which we need. So far so good. This coronavirus has been available for a family of coronavirus, which is the easiest one everybody knows is common cold. When you catch cold, it's the coronavirus. But what they did in the lab, they added some different agents from the foot of a bat into that virus, so it became COVID-19 or problem which is causing so much problems in the world. So we have to fight against it. One thing which I have said to some of my friends, some of my patients, and some for youngsters, whenever I have class with them, the question I have for you, have you ever changed your motor oil of your car? Either yourself or by a technician or mechanic or someone. Have you ever done it? Of course. Anybody who drives, anybody who owns a car has to change oil every now and then based upon the rules and regulations of the engine and its work. The first thing you have to do is to turn off your engine. While you are eating all year round for 12 months continuously, when your body system has the chance to turn off, shake itself, and then remodel, and then continue. In medicine, we greatly know that God has created beautifully the great tendency in our bodies. So we always have tendency for healing. We have a tendency for improvement. For example, when we do surgery on a patient, what we do at the end? We bring skin edge to skin edge together and stitch it. We never cause any healing of that skin. The tendency in the body for healing promotes the condition and makes it beautifully clear, either with or without scar formation, and patient is well, healthy, happy, and goes back to work after some certain time. When you fast, there are some cell components called lysosomes. Lysosomes have caused, in 2016, Professor Yoshinori Asumi from Japan to be a Nobel Prize winner. Why did he win the Nobel Prize? Because he discovered when you fast for longer than 9 hours, your cell lysosomes start to do something which we call it autophagy, or in Farsi they say autophagy. Autophagy is self-eating cells by themselves. So by this great discovery, they realized that all cancer cells, all redundant cells, all bad cells during fasting for longer than 9 hours per day for a certain time of period, you have a better chance to prevent cancer, to prevent further disease, to remove all problems and promote your immune system. Now combine what I said to what Dr. Safavi nicely stated about the ingredients which you have to take. Automatically, you know that Islam orders we have to fast all day long from dawn to dusk. Dawn to dusk, not sunrise to sunset, not less, not more. No. Only, as Quran says, وَأَتِمُّ الصِّيَامَ إِلَى اللَّيْلِ, meaning, and finish up your fasting until the night. What is the definition of night? There is a big difference between sunset versus dusk, which is the beginning of the light or night. In the other part of our discussion, I'm going to present you a couple of important points from Quran and Ahadith, meaning narrations we have received from successors of Prophet Islam, peace be upon all of them, so that when you fast, you make yourself healthy. When you fast, you cause a variety of different preventions for any further unexpected diseases in your body. In this regard, it is very important that if you can fast, you have to do it. Again, I'm only talking about the physical aspect of it yet. Another question which was presented was, what are the specifications for during the breakfast, or you call it iftar, and during the before time or pre-dawn, when you wake up and you eat? What specifications should they have? Dr. Safavi has already stated all the different information. Dr. Safavi, another question is, do you have any particular recommendation based upon your own personal and scientific background? Do you have any kind of recommendation how to prevent for dryness of mouth and possibly sometimes excessive thirst which happen during the daytime, particularly in those areas which not right now, which we are, as you know, Ramadan is now in the spring, but a few years ago, and again about 15, 18 years from now, again, we are going to have it in the long days of summer. So what would be your recommendation? I appreciate if you also comment in that.
First of all, let me say that I learned about a lot about your explanations. Was very scientific, and I learned a lot about your discussions that you already presented. I would like to add this point that since during the day, we of course need to take more water. Water is very important for our metabolic system, and also we need it for other purposes that is very important, maybe 20 or 30 actions that water itself can have on our body. So to prevent this thirst, we need to take the foods that are containing food, but release it not quickly, but slowly, such as let me explain about lettuce. Lettuce is one of the parts of our normal salad that we take. More than 90% of lettuce is water. So other fruits such as watermelon, melon, and also citrus fruits such as orange and other vegetables also, like tomatoes, they have lots of water. If we take salad with our foods, breakfast, or also in suhoor, in the sahar, for instance, we are fooling our body with this water to release it slowly during the day. So we don't practice thirst during the day. In some countries and in some seasons, more than 20 hours, people don't eat, don't drink during fasting. So it's very important to mobilize the body with these vegetables and fruits. Drinking normal water is very important during iftar and sahar, and also we should take these vegetables during our eating to help avoid this thirst during the day. And also dry mouth is one of the very difficult experiences that especially people such as yourself and myself that we teach, and also we talk with patients a lot. So we need to do not experience this thirst. So it's better to take vegetables and also fruits a lot during the iftar and sahar. When we talk about the amount of that, the World Health Organization, WHO, offers 2 to 4 units of fruits and also 3 to 5 units of vegetables. When we talk about one single unit of fruit, we can make an example such as one normal orange. And when we talk about vegetables, every unit of vegetable is 1 glass full of vegetable, raw vegetable, and half of a glass of cooked vegetable. So when we talk about 3 to 5 units of vegetable, we should take that. For instance, with our salad, with our foods that are containing cooked vegetables, and also fruits, very important to avoid this thirst during the day, such as watermelon, melon, etc., which help you a lot, and also we do not experience any thirst during the day. People that usually do not take enough water, they will involve in problems such as stones, urinary stones, and also difficulties in urine excretion. Lots of disease, especially for elderly, is happening when they do not drink enough water. So during Ramadan, we should offer especially vulnerable people such as weaning mothers and also pregnant women and elderly, and especially those that they are growing, such as adolescents, to take enough water in matters of drinking water, normal water, and also vegetables and fruits.
Thank you so much. And in continuation for what Dr. Safavi said so far, practically, I would like to recommend you a couple of important points to avoid long-term thirst or dryness of your mouth, or so on and so forth. Keep in mind that in the nature, because of the rule of the nature, 2 things never stay in our body as soon as they become their pure formula. The number one is water. As it becomes H2O, pure, that becomes subject to ejection and rejection out of body through the kidneys. I see Dr. Safavi is drinking water because his local time is after iftar and he's well to do it. But we in the West still have a noon time, and our time is right now as I speak is 2:31 p.m. So we are fasting. All right. Number two is glucose, sugar. As soon as glucose becomes C6O6OH, its pure formula, it gets immediately rejected out of our body, either in the summertime as energy, or in the wintertime and in specific areas which have the cold weather, it converts to some biochemical path and becomes fat and stored in your body as fat. I'm not talking about the glucose right now, I'm talking about the water. So the best recommendation to avoid thirst during the daytime is do what we do in emergency room. When a patient is brought into emergency room as badly dehydrated, and patient may die at any moment, what we do not inject IV immediately pure sterile water. No. What we have it is a normal saline, water and salt, water with dextrose, water with alcohol. Always we combine water with something. Practically, if you're waking up before dawn time and you would like to have your meal, keep in mind, either during the Ramadan or after that when you're heading toward the summer now, whenever you are thirsty, the best water you can use is, of course, purified water and clean water, but take a lime or lemon and squeeze fresh drops, few drops only, into that water, a glass of water which you're going to drink, and then drink it. Combination of lemon drops with that water causes some kind of fooling your kidneys, so the kidney does not reject it out immediately. So as he said correctly, you can continue. You can add this few drops of lemon drops or lime drops, doesn't matter, which is green or yellow, and then drink it. It is more tasty. It is going to be combined and it's going to last in your body longer. Now, Dr. Safavi said briefly about some point for the pregnant ladies and the breastfeeding ladies, which was one of the questions presented, which is, are they able to fast during the month of Ramadan? Besides of that, how about the adolescent who are growing up to the puberty? According to their growth, what do you recommend? Do they have the chance to fast or not? As I said earlier, and for newcomers to our gathering, I would like to repeat. Number one, we do not have a single prescription for entire population of the world. You look at your own self, dear lady, if you're pregnant or if you are breastfeeding your child, your infant, see, can you survive? Not survive. Can you be functional? Can you feel well when you fast or not? Because Islamically, if you have only and only the probability of some kind of damage to your system, automatically fasting becomes forbidden for you. It becomes haram, forbidden. You should not. But I have seen in many years, many ladies who are pregnant or are breastfeeding, and then at the same time they can fast. The only thing is what they do during the sahar or pre-dawn, they drink some milk themselves, and they include milk as well during the breakfast time by the beginning of the night. So it helps them for breastfeeding. And then it is very much important. Also, let me add a little bit another point here, which is, how about the diabetic patients? How about the hypertension patients? Those who have high blood pressure? Every single individual has to be taken care of individually. We cannot say again, one rule here for everybody. No. Hold on. If you have high blood pressure and you can take your blood pressure medication which your physician has already prescribed to you, you can take it before dawn and you can take it after breakfast, before sahar or iftar. If you can do it that way and your blood pressure consistently remains under control, go ahead and take it. If you feel it endangers you, if all doctors in the world tell you that you're fine to fast and you feel between you and your Lord, you feel that you cannot, and it is the probability of some danger or some problems to your health, it becomes forbidden on you. The other question which is there, Dr. Safavi, I'd rather you comment a little bit more about diabetic patients, please, during Ramadan. And if you mention any particular point that diabetic patients who can fast or those who cannot. Those who cannot, they should follow the rules and regulations of what their doctors have prescribed. And excuse me for a second, let me add, unfortunately, in Middle Eastern countries, vitamin D insufficiency or worse than that, deficiency are very much abundant and is very much available. Second thing, which we do not pay attention to it, is hypothyroidism. If you have, for example, some patient come to my office and I'm treating them for something else, for chronic pain, which is a very difficult case to handle. Okay. I realize the numbers for this particular lady, particularly women, have more problems for hypothyroidism, meaning having less thyroid available in your body. The number within the College of Endocrinology, the number apparently seems okay. It is within normal limit, for example. But patient has, out of 7 signs, if that particular patient has 2 positive signs or more, immediately I put them on some kind of thyroid tablet appropriate for their situation. And then control it after 3 months or 6 months or both. So keep in mind, vitamin D and thyroid in Middle Eastern countries, all around Middle East, unfortunately are very, very much abundant, and they are frequently found, and they have to be taken into consideration. So please make sure. Dr. Safavi, at your service. Go ahead, please. About diabetic.
Yes, you explained nicely about these patients, and I would like to add some other points regarding diabetic patient that you mentioned already. I have to say that diabetic patients, because they inject insulin every now and then with the offers and instructors of their physicians, they have to follow that exactly, because if they do not follow that, they will involve in very, very hard situations. So we usually divide diabetic patients into 2 groups. Group 1 is diabetic that they are insulin dependent. Insulin dependent patients that are, for instance, people that they, from the beginning of life, they have this problem of diabetic, and also the people that they will involve later on in their life. So they cannot fast because of getting insulin, and also the patients that they have to, by the instructor of their physician, take tablets every 4 hours, for instance, so they cannot avoid that, so they have to take those tablets, so they cannot also fast. So they have to postpone their fast to other times. Hopefully they will get better and they can, be fast during other months of the year. The other patients are patients that they have kidney problems. Kidney problems also are patients that they can, we can explain that the people that they, produce stones every now and then. So they also cannot fast because they have to drink a lot of water during the day, and they cannot be thirsty during the day, so they cannot fast. Also, about pregnant women and also weaning mothers, I have to mention that this exactly depends on their physicians and also the situation that they practice themselves. So they have to be careful because they are weaning the baby, they are feeding the kids and babies, and they need to be very careful about what they take. Usually, when the body of these mothers are not prepared enough to fast, physicians do not recommend to them to fast. And it's very important to make sure that if this fasting is not beneficial to them and is harmful to them, they should know that it's forbidden in Islam also. So it's better to make sure from the beginning of the month. I had one patient today in my office that she didn't actually follow the instructions of her doctor, and today she was ill because she started 5 days of fasting, and during these 5 days, especially today, she had heartburn, and yesterday she had a headache. So it's not good for them. It should be very careful to follow exactly the rules and instructors of Islam itself. Islam is the rules that want to help us to be healthy, not to harm us. So I would recommend every single patient that is involved in any of these diseases, such as hypertension, such as diabetes, and also kidney problems, and also headaches and migraine. They have to consult with their physician and make sure that the fasting is not harmful to them, and follow exactly the instructors. Also, the main thing for people that they are ready to fast, to make sure that during the iftar and sahar they have to take enough food to get enough energy from the food, get enough protein, carbohydrate, and fat from the food, and also get enough vitamin, mineral, and water from the diet that they are following.
Thank you so much. And I don't like to miss a couple of points which I had in my mind, and you nicely pointed to those. For some people who have arthrosis or arthritis or some chronic pain, keep in mind that there are a couple of points here when you fast. It is proven scientifically now that particularly arthritis, the suffix of itis means inflammation. It can be acute, subacute, or chronic. Arthrosis is when that inflammation is almost there or not there, or is it gone either, but the effect of that inflammation is changing the surface of joints. So it's called arthrosis. It is very much treatable. How? Rheumatologist colleagues inform us that there are some certain proteins, when they are in excess in our body, they can aggravate the problem with arthrosis. During the fasting time, because you are reducing the amount of intake of your protein, automatically your pain of arthritis or arthrosis, by experience, in majority of people, more than 87% of people, reduces, which is very good. And now, because we have some kind of time constraint and we have to quickly switch for about less than 10 minutes in spiritual aspects of fasting, and please, Dr. Safavi, if anytime you had any comment, please interrupt me and let us enjoy your input as well. I would like to remind those who possibly joined us later about the mission of IRIC, which is the host and sponsor for our discussion today. Just a second, please.
In 1990, a group of Muslim graduate students in Washington, D.C., USA, established the Islamic Research and Information Center, IRIC, as a nonprofit NGO. IRIC attracted highly qualified and talented researchers and experts to undertake projects related to contemporary Islamic issues in the Western world. Our vision is introducing Islamic teachings to the public in the West, with particular emphasis on research and academia based on the Holy Quran and the traditions of the Holy Prophet of Islam, peace be upon him, and his infallible progeny.
I would like now to switch quickly for only a few minutes about a couple of issues about fasting. As we said, and as you know it better than anyone else, I hope, and also if there is any non-Muslim audience among us, I would like to mention an important point, that the spiritual aspect of fasting prevails all of the physical problems which we discussed and how to treat them and how to deal with them. The privilege of fasting. Number one, according to Holy Quran, in ayah number 183, Surah Al-Baqarah, Surah number 2, verse number 183. If there is any non-Muslim audience among us, I would like to state only a few points here. Verse means ayah, ayah means verse, and surah is the chapter. So if you don't mind, I'd rather to use Islamic terminology instead of some other terminologies. In surah number 2, ayah 183, Quran says, أعوذ بالله من الشيطان الرجيم يا أيها الذين آمنوا كتب عليكم الصيام كما كتب على الذين من قبلكم لعلكم تتقون. Priority number one, which fasting causes, is the increasing level and addition to what you do to increase and promote your piety and taqwa. And God says in this glorious verse, O believers, decreed upon you is fasting, as it was decreed upon those before you, that you may become righteous. So righteousness or piety is going to be improved while you're fasting. But there is a point here which I have to emphasize. When it says in the ayah, عَلَى الَّذِينَ مِنْ قَبْلِكُمْ, those who have been before you, Hafs ibn Ghiyath al-Nakha'i asks sixth Imam Ja'far al-Sadiq alayhi salatu wassalam. And Imam Salawatullah alayhi says, لم يفرض الله صيامه على أحد من الأمم قبلنا. Allah has not considered, has not decreed, has not ordered any of populations or people of other religions before Islam. Hafs ibn Ghiyas says, Ya Rasulullah, Quran says, Ya ayyuhalladhina amanu kutiba alaykum as-siyam kama kutiba ala alladhina min qablikum. Before you, some people, yes, please pay attention to the ayah. All those who read and recite Quran with some specific attention. Ayah does not say, ala umamin min qablikum. Does not say on groups of religions before you. It says alladhina min qablikum. Some of those people who have been in. So Imam Sadiq sallallahu alayhi says, إنما فرض الله الصيام شهر رمضان على الأنبياء دون الأمم ففضل به هذه الأمة. Those who were responsible to fast for 30 days period were only prophets before Prophet of Islam. And Allah has given excessive and special privilege to this particular religion and its followers. وجعل صيامه فرضا على رسول الله صلى الله عليه وآله وعلى أمته. Then Allah made it mandatory on Prophet of Islam and his followers and his people. Another hadith, and this is in the book of من لا يعذره الفقيه رسائل الشيعة فضائل الأشهر الثلاثة نور الثقلين and some other references. Another hadith, Imam Sadiq again, salawatullah wa salam alayhi, says, أول ما فرض الله الصوم لم يفرضه في شهر رمضان إلا على الأنبياء ولم يفرضه على الأمم. Same concept. When God made it wajib, made it mandatory, He put it on only prophets. So we are narrated that Prophet Musa, peace be upon him, Prophet Isa, Jesus, peace be Moses and Jesus, peace be both of God's peace be upon them, they were fasting 30 days and 40 days. But right now, if you look, investigate, among our Abrahamic religions, Jews, Christians, or any other one, there are some fasting, but not 30 days in a row. And then, Imam Sajjad, fourth Imam Zayn al-Abidin salawatullah alayhi, says and presents it to God. ثم آثرتنا به على سائر الأمم واصطفيتنا بفضله دون أهل الأديان فصمنا بأمرك نهاره وقمنا بعونك ليله. You privileged us, O Lord, upon other in comparison to other groups of religions, and you chose us with your privilege, so we fast during the daytime and we raise and pray during its nights. Okay, so the first privilege and first result of fasting is to promote and increase the level of righteousness and piety. Secondly, according to Amir al-Mu'mineen Imam Ali, successor of Prophet sallallahu alayhi wa alayhi, it is a practice for purification, and it's a practice for purifying the intention in people. Amir al-Mu'mineen sallallahu alayhi says, الصوم الصيام لابتلاء إخلاص الخلق. In the book of Ghurr al-Hikam, he says, fasting is an examination, is a testing for purification of people, because there is no show off during your time. During fasting time, all ibadat, all worships, whatever you decide, there may be a chance of showing off someone, which we call it riyah in Persian language. or Arabic. But in fasting, there is no such a thing available. And Fatima al-Zahra, salamullah alayha, daughter of Prophet of Islam, peace be upon them and their infallible progeny, in her sermon in the masjid says, فَرَضَ اللَّهُ الصِّيَامِ تَثْبِيتًا لِلْإِخْلَاصِ. Allah made fasting mandatory for establishment of purification in your practice, in your intention, in your life. Another point, which is the third one, Amir al-Mu'mineen salawatullah salamu alayhi, Imam Ali says, لِكُلِّ شَيْءٍ زَكَاةٌ وَزَكَاةُ الْبَدَنِ الصِّيَامُ. In the book of Bihar al-Anwar, the glorious book, which references from the book Nawadir al-Rawandi, page number 4, this hadith is mentioned and stated, and also it is in Nahj al-Balagha as well. For everything in the world, there is a zakat and there is some Islamic tax. وَزَكَاةُ الْبَدَنِ الصِّيَامُ. And the zakat for your body is fasting. Number 4, Imam Raza salawatullah wa salamu alayhi is questioned. Someone says, فَلِمَا أُمِرُوا بِالصَّوْمِ. Ya Ibn Rasulullah, why Muslims are ordered to fast? قال لكي يعرفوا ألم الجوع والعطش فيستدلوا على فقر الآخرة. He says, so they practice, they get acquainted, they get familiar with some thirst and some hunger. So it can prove to them that in the poverty of the Day of Judgment, such a thing may exist. So you become automatically, by your fasting, you become somehow more and more good believer in the presence of Day of Judgment, which is one of the bases which we strongly believe in Islam. And the last point, which is a privilege of this fasting, is to have some kind of similarity and some kind of taste and some kind of understanding, a better understanding of for poor people. Imam Hussein, third Imam, salawatullah wa salamu alayhi wa alayhi, says, ثُمَّ افْتَرَضَ اللَّهُ. He was questioned again. لَمَا افْتَرَضَ اللَّهُ عَزَّ وَجَلَّ عَلَى عَبْدِهِ الصَّوْمِ. Why Allah has ordered on His servant and His abd to fast. And He said, قَالَ لِيَجِدُ الْغِنَى مَسَّ الْجُوعِ فَيَعُودُ بِالْفَضْلِ عَلَى الْمِسْكِينِ. I'm sorry. قال ليجد الغني مس الجوع. The wealthy people can understand what's going on for those who are poor. They don't have meal to eat. They don't have pure water to drink. They don't have any access to anything because they are poor. So those who are wealthy, they can feel, so they can have some privilege and some assistance for those who are poor in the society. Also, the last word I would like to mention, there is some gentleman, Hamza ibn Muhammad, asks Imam Askari, Imam Hassan Askari, father of Imam Mahdi salawatullah alayhima, why fasting is there? And Imam says, لِيَجِدُ الْغَنِي مَسَّ الْجُوعِ فَيَمُنُّ عَلَى الْمِسْكِينِ. So wealthy people can feel the problem, the pain, or the pressure of hunger, and then he would have more bestow on those who are poor. In this regard, what we say at the end of our discussion, although we are now at the end of our time, and now is 3 o'clock, and we are supposed to quickly wrap up and say goodbye. But because comments have not been presented. If everybody agrees, anybody who wants to leave, please do so. Anybody who has some comment and would like to share with us, I'd rather to have some kind of comments for about 5 minutes, and then Dr. Safavi and I would be more happy to answer if there is any question or any comment. If there is any comment, please go ahead and do it. Dr. Safavi, any particular comment here from your side?
I would like to end up my discussion with some points that are very important for helping people to fast better, healthier, and also follow the instructions of Islam. It's better to get the foods that can prevent inflammation, as you said, and these are the foods that can boost the immune system. For instance, citrus fruits, red bell peppers, broccoli, garlic, ginger, spinach, yogurt, especially low-fat yogurt, almonds, sunflower seeds, turmeric, green tea, papaya, kiwi, and shellfish. These are the main foods that can help boost your immune system and also get rid of inflammation. So people that even before Ramadan, they have been involved in some diseases like the diseases that you mentioned, arthritis, rheumatoid, and also other diseases such as hypertension, diabetes, etc. I would like to offer them to get these sort of foods that can help them to get antioxidants, as I begin with antioxidants, especially vitamins such as vitamin C and vitamin D especially, so they can be healthy and finish their Ramadan, inshallah, with lots of gaining from this month, apart from things that can help their spiritual situation. It would be much better for their body health. Let me just mention about athletes also, that some of them, they think that since they are doing exercise every day, so they cannot fast. I should mention that they can change the hours of their practice of exercise. They can go to places that are not very hot to can fast much better, and also to avoid these emptying of body from water. So they have to get more vegetables and fruits during times of iftar and sahar to be healthier and do their exercise. These athletes are very important, this fasting, for their health, because in some cases we can see that in studies that they have done in universities, different universities in the world, that before, if we compare their health situation before Ramadan and after Ramadan, if they fast, they will get better, much more better when they have been involved in fatty liver, in diabetes, in pre-diabetic situation, and they will solve these problems with fasting, most of them, that these papers can offer lots of scientific views that is very important to read these papers, get familiar with the results of those, and find more beneficial effects of fasting.
Thank you so much. And because of our short time, I apologize if I do not mention Mr., Miss, Ms., or Mrs. before name of anybody who has put some comment or question in. I just read some of them. Some of the audience have already expressed the appreciation, which I really appreciate, and I hope we deserve to have this kind of appreciation. SMS Rezazadeh has asked the question that how can we do our workouts during Ramadan? It depends it differs from person to person. If you would like to do some workout and you have to go to gym, or you would like to continue your athletic activities, possibly the best time would be something, I'll just make a kind of suggestion. That's up to you, and this is you how to decide and how to perform. Possibly if within last hour before breakfast, before iftar, or half an hour, 45 minutes before breaking your fast during the dusk when it happens, if you do that time, if you happen to do your workouts there, if there is any energy loss, or if there is any thirst, or there is something, it is readily available there, and you can break your fast at the time, appropriate time, and drink and eat whatever you decide. Farzan Nouri has asked a question that how can I, is it possible if I can fast but only drink some water? Because without water I have bad headaches. Please keep in mind, my dear sister, that headache has at least something about 110 different reasons and causes. Insufficient amount of water is not the only reason for headache. So I'd rather you and your primary care physician or any specialist or any neurologist or pain management doctor investigate what is the cause of your headache rather than anything. But because you have asked this question, the answer is, depending upon the Grand Ayatollah or Marja who you follow, there are some people who are, for example, like diabetes insipidus, or another terminology which is in Arabic, they call it the disease of atash. The person is constantly thirsty, and this is a disease, and that person wants to have possibility to fast and also fulfill his body requirement. Based upon referring to your own marja or Grand Ayatollah, if there is a possibility, and if because your headache is only induced by shortage of water, under that specific permission, there may be a chance that you can only drink water during daytime, for example, twice, 3 times or something on certain times, and avoid any other thing and continue your fasting. Again, this is fiqh, this is jurisprudence, and it is in need, you need to get in touch with the Grand Ayatollah or your marja. Alexi 1687, thanks for presentation. It was very informative. Thank you. We appreciate that. Amir Hussein Khoshsima has a question that how to correct way to pray and good and God accepts those. Before I answer you, if you're talking about the pray about salat or namaz or prayer, which you do the 5 times a day, before I answer you, I'd rather to quote Prophet of Islam sallallahu alaihi wasallam. As you know, possibly in Islam, the introduction to haram thing is haram, and introduction to wajib or mandatory thing is wajib or mandatory. Prophet sallallahu alaihi wasallam says, if you would like to have a better attention in your prayer, when you are making ablution or wudu, at that time start to have, as introductory point of your prayer, start to have some dua and some attention toward Almighty God, and then make your wudu. Yes, it is very difficult for some people during their prayer that when they are doing their prayers, unfortunately, because of some different factors, including seductions of evil or Satan, they are paying attention to everything and they are planning, they are doing this, they are doing that. Assalamu alaikum wa rahmatullah, they finish. No. Always remind yourself that I am before Almighty God, who is my creator. And in hadith or riwayah we have al-musalli munajim rabbah. The person who is doing his or her prayer is directly talking and presenting himself or herself to his or her Lord. In that regard, most likely when your attention is correct, when your pronunciations are correct, when everything you present is correct, there is no reason necessarily to have no acceptance by Almighty. Because إنه هو الرحمن الرحيم إنه هو الغفور الودود إنه ذو العرش المجيد, and a variety of different descriptions which have been stated in Holy Quran about that. Another person has said, I have had partial removal of kidney and fast. What is the symptoms of irregularities I might face? One of the things which you can have, if you have partial removal of your kidney because of presence of cyst or some kind of genetic factors or some kind of trauma or accident, but because of any reason, you twice as much may be in need of drinking water, which already have been stated during our discussion. But irregularities you may face, I say something to all of my patients unanimously, and I would like to repeat it to you as well. The best doctor in the world for you is yourself. If you focus and pay attention constantly, I have some problem with my kidney, definitely you're going to get it, those problems. But if you try to avoid thinking about it, if you try to say something else and then pay attention to your normal life and try to be as active, as functional as you can be, most likely no irregularities come to you. Because psychosomatic problem is a big problem in medicine today. In some traditions, in some cultures, like Chinese people, they are prohibited. Doctors are not supposed to say the diagnosis to the patient. And it is documented that some patients who have cancer of lung live much longer than those who are in the Western countries. So the irregularity which you may have, make sure that your body is not dehydrated, period. Don't think about it and trust in God, and inshallah you will be in the best of health and shape. Another point here is Orthodox Christians, holy books recommend a total of 180 to 200 days of fasting per year. Okay, that's a good point. Thank you. I answered already that question. Okay, continuity of the same gentleman's question is, this is the first year after surgery and I have been fasting so far. God bless you, and make sure that your body does not get dehydrated, and please follow your nephrologist and urologist orders if there is any specific in this regard. Thank you so much for comments they have said here. And when we eat dinner right away after iftar, question. That's upon your personal choice. That's up to you, and whatever you decide would be possibly the best. There is no particular recommendation in that. Arya Farhad, thanks a lot. I learned several new things from your speech about fasting. I'm glad to hear that, and I beg Almighty to accept it as well. It's important that those who practice one of the Abrahamic faith to discuss fasting together. That's a good idea. We would like to ask our sponsor, IRIC, to see if there's any possibility to do such a thing. Is there any time spot or not? Okay. Okay, we are at the end of our time by far what we expected. Dr. Sababi, last terminating statement. If you have any point, please go ahead, and we need to terminate this session now.
Yes, there was one of the questions was, can we eat our dinner right away after iftar? I should explain that getting lots of food stuff exactly after breaking the fast is not good. So it's better to begin with some boiled water and dates, for instance, and also a vegetable soup, something like that. Some prefer to get bread and cheese and walnut, something like that. That's okay. But the main thing is dinner, which is usually such a the same as lunch. So it's better to eat that about 45 minutes to 60 minutes or 1 hour after iftar. Because in some cities, even in Iran, we can see that people usually, when they break their fast and eat their iftar, they right away go to dinner, which is not a good point. So it's better to, wait some time, about 45 minutes at least, and then go for dinner, because it's much better for their gastrointestinal tract, and is much better for them to get the dinner and take the dinner slowly after that, because in some cases we have seen that fatty liver and also diabetic patients comes from this sort of bad habits of eating. So I prefer to mention this about that question.
One more time, I would like to thank Dr. Safavi.
You're welcome.
To have wonderful presentation, and also I would like to thank all of our audience. And if there were any point or something which we did not address, I hope that you can forgive us and let us have some more discussion, inshallah, in the near future. Wassalam. And let's finish it up with the dua. Yeah. اللهم صل على محمد وعلى محمد وعجل فرجهم. اللهم كل وليك الحجة ابن الحسن صلواتك عليه وعلى آبائه في هذه الساعة وفي كل الساعة، وليا محافظا وقائدا وناصرا ودليلا معينا، حتى تسكنه أرضك طوعا وتمتعه فيها طويلا. اللهم عجل فرجه وسهل مخرجه. Ya Allah, expedite reappearance of our contemporary Imam Mahdi salawatullah alayhi. Wassalamu alaikum wa rahmatullahi wa barakatuh.
Thank you and have a good night.